Hello, I'm Christine Hancock from C3 Collaborating for Health. Delighted to welcome you to today's international seminar. And Dr. Carlene Radix is going to talk to us about healthy environments and health empowerment, lessons from the Caribbean. And for those of us shivering in the Northern Hemisphere, certainly in London, we find it hard to think that of a more healthy environment than the warm climate of the Caribbean. But also we know about the level of poor health and particularly chronic disease, NCDs, within the Caribbean. Talking to Caribbean friends and colleagues in the UK, they talk about the epidemic of diabetes at a time when we're all talking about other epidemics. C3 Collaborating for Health is a global health organization headquartered in London and working collaboratively with multiple stakeholders to address the need to prevent chronic disease. And one of our big programs is working in the environments of some of the most disadvantaged communities to help empower them to take control of their environment. So I'm delighted this evening that for us, that we'll be learning the lessons from the Caribbean. In the UK, and particularly perhaps in London, we have a rich Caribbean community. I'm a nurse by background, and I'm old enough to have trained with many, many people from what we now call the Windrush generation, the people who came to nurse, to staff our hospitals in London many, many years ago. But this evening, it's Dr. Radix, who we're really thrilled to be listening to, and I'm going to hand over to her and she can tell us about the lessons that we and the rest of the world can learn from the Caribbean. Carlene, over to you.
Thank you so much, Christine. And it's such a pleasure to be here. Seems like we have a very intimate gathering. And so I'm hoping we can be a bit interactive. At least we'll have some time to discuss. A disclaimer, I certainly don't speak for the entire Caribbean, but I thought I'd put something together with regard to the interconnection between environment and health and how that's so present in our region. So if I could share my slides, would be great. Thank you. Let's just see if I can do this correctly.
Looks like it's being a bit slow.
No, I haven't hit share yet.
All right.
Okay.
That's all right. Take your time.
Yeah, I'm realizing I have too many things open on my desk, so I just had to close some things so I can find what I need to share with you.
Well,
bear with me.
That's all right. More people are joining as you continue, so that's fine.
Okay. Okay. I think I should have it clearly now.
That's good.
Great. You should be able to see.
Yeah, certainly can.
Wonderful. So just a little bit of philosophy, at least on my end, and that is that healthy environments are empowering. A lot of the time in terms of issues of health, we put the responsibility on the individual to make healthy choices and to be empowered to make healthy lifestyle changes. But really, the empowerment comes when there's the availability, the accessibility, and the environment is well placed in order to help you to be healthy. So this talk is really going to focus on the environment, but I wanted to make the point that healthy environments are empowering. A little bit about me. I am a physician by training. Most importantly, I am a Caribbean woman. I've lived and worked in several Caribbean countries, and I think of myself as an Earth citizen. So it means that what I have to say is both relevant locally, but I hope also globally. And so what are some of the things I'm going to discuss in this relatively, I think about 20 minutes before we can open up for discussion? I'm going to speak a little bit about the small island states of the Eastern Caribbean, a bit about the disaster risk, something about chronic diseases, the climate crisis, the food and nutrition security issues, and the intersection of it all, because it's all connected. And then we'll talk a little bit about some of the lessons from the Caribbean. And then I have a question for you. What can you do in terms of these environments? So I think the information I'm about to share is not anything new, but what I'd like for you to do is to sit and contemplate your connection with this information. What does it mean for you individually, for the environments that you reside in, work in, live in, and how is this related to improving health? So just a little bit about the Eastern Caribbean. I should tell you, I work for the Organization of Eastern Caribbean States. This is an organization which is focused on the regional integration of several states along the Eastern Caribbean border. And if you look at a map, and if you know where the Caribbean is on the map, and you look at the chain of islands along the eastern border, you will see most of the countries that are member states of the Organization of Eastern Caribbean States, and certainly most of the countries represented here, from the Virgin Islands in the north. So we're looking at Tortola, Virgin Gorda, all the way to Grenada in the south, just before you get to Trinidad and Tobago. And if you know the map, soon after that is the South American continent. Just to say, in the Organization of Eastern Caribbean States, we're small island states, and what goes along with that, we're small states, we're island states. We have vulnerable economies. At this point in time, they're very tourism dependent. Of interest within the Eastern Caribbean, we have a common currency, the Eastern Caribbean currency, and this allows for some form of integration. I make note, though, that traditionally or within the past, even though we share a sea, a common history, a common geography, and common health issues and environments, the Caribbean has been separated based on its history of colonization. And so you would find that the English-speaking Caribbean versus the French-speaking or Spanish-speaking Caribbean would have developed connections of transportation, of networking between themselves and the countries of which they may still be dependents of or were former dependents of across the Atlantic, more so than even between themselves right there in the Caribbean Sea. So I just thought I would point out that anomaly, and it's one that we are trying to overcome. So the Caribbean region has been called in some circles the most disaster-prone region of the world. You may or may not agree, but it's certainly very disaster-prone. So the Caribbean, that chain of islands that you looked at on the map, are mostly a chain of volcanic islands and are along the Caribbean tectonic plate where it meets whatever the other plates are. And so you would see here, and I'm showing you the juxtaposition of a hurricane along this chain of islands that you were looking at, just to show the magnitude of impact. But you can see the chain of islands here, mostly volcanic, where that plate is. And it means we are prone to earthquakes. We are prone to volcanic eruptions. And the most recent eruption was in St. Vincent and the Grenadines. And we are prone to extreme weather events, specifically hurricanes coming across the Atlantic. They've become more frequent and more severe. So we know in 2017, we had devastation, significant impact on more than half of the 11 member states of the OECS by hurricanes Irma and Maria. And the top picture you see there is the island of Dominica post-Maria. And we've had subsequent, we've seen what happened in the Bahamas. And things are just becoming more severe and more frequent. We also have torrential rains, flooding. Guyana was impacted by flooding earlier on this year, storm surges, and other such events. Let me just switch gears and speak about chronic diseases and NCDs. And this is a focus of C3 and our collaboration. Chronic disease, morbidity and mortality within the Caribbean is certainly out of proportion with the rest of the world. Within the Americas, the Caribbean has the highest mortality rates related to NCDs. And what do we mean when we say NCDs? We're talking about those diseases such as hypertension, heart disease, diabetes, cancers. And so these are the leading causes of death, but they also are, we have the highest mortality rates. We also have the highest rates of premature deaths. And I wanted to take a moment here, I put in brackets there disability, because this slide doesn't even begin to speak to the issues of disability related to chronic diseases that we face within our region. So we have high prevalence of diabetes, high prevalence of hypertension, and estimates go between 10 to 25% of adults and 20 to 50% with hypertension, adults with diabetes, and 20 to 50% of adults with hypertension. And this last one really makes you stop and think. More than 85% of adults do not meet recommended levels of fruit and vegetable intake. Now, you may think about the Caribbean, and you think about our environment, you think about fruits and vegetables aplenty and abundant, and you may ask yourself, why is this statistic like this? And so it's a very good question. This picture I took from, I was supposed to say where I took it from. I took it from a Caribbean publication, the Trinidad Express, to be clear, a newspaper in Trinidad and Tobago, speaking about the disability from chronic diseases. Now, rates of disability are also disproportionately high. The number of amputations as a result of diabetes are extremely high in our region. When you talk about the disabilities related to stroke, which is much higher, which we have a high risk of, and limited health system ability to respond once a stroke has occurred. You're talking about kidney failure and patients who are dependent on dialysis. And we know how that affects quality of life, and even much more so in areas where access to dialysis is limited. And of course, blindness. So we still have people with resulting blindness from these chronic diseases. So when you talk about disabilities within our region, the main contributor to disability is chronic disease. So I'm taking this quotation from the Healthy Caribbean Coalition, which is a coalition of civil society organizations responding to chronic non-communicable diseases. And again, this speaks to the philosophy I mentioned before. The risk factors and behaviors that contribute to the NCD epidemic take place within particular social, economic, and physical environments. And we need to ensure that these environments help us to live longer, healthier lives. And I give you a few pictures here, real pictures of the Caribbean region, the beautiful region in which I live and work, Dominica, the Nature Isle. We have one of our beaches, and certainly the kinds of fruits and vegetables that are available at our marketplaces. So let me ask. So I'm going to switch gears for a moment and speak about the climate crisis. Now, we in the Caribbean choose to use the word climate crisis rather than the phrase climate crisis rather than climate change, because it's not just a change for us, it is a crisis. I am a health professional, so if I had my colleague, Mr. Emmanuel here, he would give you the details of the numbers like I could do with chronic diseases, but I can give you the overview because this affects all of us within this region. And we know what's happening globally. CO2 levels are rising, temperatures are rising, sea level is rising. And this particular picture actually was commissioned by the Organization of Eastern Caribbean States by one of our local artists around this climate crisis. A similar picture was done, or similar pictures were done for the last COP, but really it shows us who is really being affected by the decisions that we're making around climate crisis. So we have glaciers melting. I understand that the increasing temperature means that we have increasing water vapor in the atmosphere, and this is resulting in more extreme weather events and all the resultant health issues. What does that mean for us? And I love the way, I love this the third bullet here that talks about 75% of the Caribbean lives in coastal cities, towns, and villages. And when you talk about the Eastern Caribbean border, you know, that number becomes much wider. Really, the whole, did you see the size of the island that we're talking about? Basically, the whole island is almost a coastal settlement. It's difficult to separate. There's no major inland. You have a view of the ocean almost everywhere you are, which is a good thing. But it means that we are so intertwined with our environment. So it means where we live is where we eat, it's where we exercise, everything is in one place. And so what's happening with the climate has significant impact on our ability to have healthy environments. When we have those devastating hurricanes, they can wipe out agricultural processes, and they can do so for several years in terms of full recovery to before such an event. And it's becoming worse with the more severe issues. We have issues of drought, issues of floods, and all of this makes it difficult to have a predictable food supply. I took this particular wheel from I believe it's from the CDC, which shows in the middle the things that we were talking about: increasing CO2 levels, rising temperatures, more extreme weather, rising sea levels, and the general environmental impacts that those have. We have extreme heat, environmental degradation, water and food supply impacts, water quality impacts, increasing allergens, changes to vector ecology, air pollution, and severe weather. And on the outer ring, we see the health effects that these cause. So you're talking about increases in chronic diseases, increases in fatalities and injuries during extreme events, issues related to malnutrition and diarrheal disease related to water supply and food, etc. And I just wanted to point out this specific issue around vector ecology. Within our Caribbean region, we've seen the re-emergence and the acceleration of existing communicable diseases and the introduction of new communicable diseases within the last few years. So we've seen dengue, which is endemic to the region. We've seen outbreaks increase. Zika and chikungunya have been introduced to the Caribbean region for the very first time within the last 5 years or so. We saw issues related to Ebola globally. And of course, we, like everyone else in the world, had to consider how do we prepare for such a case. But of course, the huge impact has been COVID-19. I don't think 2 years ago I could have predicted or written a science fiction novel to speak about what we see happening globally around the world now with respect to COVID-19. Let me just focus a little bit on food, nutrition, and security. The question was asked, why is it that persons are not eating healthily? And here's some of the questions. Within the region, we have increasing levels of poverty and unemployment. And when you speak to the devastation related to the types of climate-related events that we speak about, it has an impact on fresh food supply and food nutrition and food security, and has an impact on economies and the ability for persons to be able to have access and availability to food. And there's also the perception, remembering that if you come from a history in which the agricultural economy was initially based on slavery, there is this sort of, I don't say, the younger persons are not necessarily interested in agriculture, in growing their own food and all of these things. They're more interested in, what's happening on the internet, what's the new digital technology, what's a new wave. And there's lots of processed foods coming into our environment. So our importation of food, despite the availability of food being grown locally, is also very high. Just leave here. I'll take a moment here just to mention the CARICOM Food and Nutrition Security Plan, which this has been certainly of conversation within the region, and it's become an accelerated conversation in the wake of COVID, because part of the issues, I spoke to you in the beginning about the transportation routes, about how things get to and from the islands based on our historical setting. So it's sometimes easier to get things imported from a United States or a United Kingdom in terms of the availability of direct transportation than it is to exchange between islands within the Caribbean. This can sometimes be affected by different systems. So the exchange may be you may be able to get there, but there may be barriers related to differences in systems and regulations, etc. And so these are the things that we need to look at internally as a Caribbean. How do we make food available, accessible, and ensure stability of the food supply, which means you need redundancy, you need food moving between islands. And I told you about the volcanic islands, which are rich and which produce a lot of food. But we also have to the north a lot of limestone islands that have to depend on the volcanic islands for food to be moved. So the intersection. What does this all mean? And I bring you to the consideration of what is the lesson learned. I stop here to talk a little bit about the lesson even from COVID-19. You may remember at one point that there was a lot of talk about the differences in air quality after lockdown measures were put in place for COVID-19. So I'm just speaking here around the threat and the opportunity, and the having been forced to relook and reconsider the environment that's right outside our door. So COVID-19 has put a brake on travel and has made us consider right where we are. For us in the Caribbean region, it has affected transportation and other issues, and it's made us think about, okay, where is our food coming from? Many people that I know have started backyard gardening again during the COVID-19 pandemic. The conversations that we're having with our children, the intergenerational knowledge exchange has improved during COVID-19. I can tell you, my children speak to their grandparents more now than they did before COVID-19, and the stories are exchanged. And we're really reconsidering what is valuable, coming off of that sort of rat race wheel. So what are the lessons learned from the Caribbean, I think, in my opinion? One is that it's all connected. We know that, but do we really know that? You know, it's really all connected. What is happening locally in your community, in your town, in your environment is connected to your health and your well-being. And looking at your environment, and we talked about some of the issues and that affect environment, the air you breathe, the water that you drink, whether or not you have social interaction with other people, the stresses of getting the basic needs of life, all of these will impact chronic diseases. Another lesson I think that comes from our region, we may be small, but we can have big impact. And so in terms of leadership, and I just highlight two cases here, certainly the Port of Spain Declaration in 2010 was a great contributor to the global shift in really considering chronic non-communicable diseases on the global stage. Before that, soon after the Port of Spain Declaration in 2010, we had global meetings around non-communicable diseases. And before that time, only HIV had been a disease considered really at the level of the United Nations on a global scale. And COP26 has just passed, and I'm sure you saw the presence of Prime Minister Mia Mottley of Barbados, who really has led with her voice with regards to the impact of the climate crisis. This is my last slide, and I think just to speak to a couple more lessons I think that we've coming from the Caribbean. One is that working together, and within the Eastern Caribbean, I think we know this lesson because this is the only way we get it done. We have to work together in order to be able to overcome. The public health approach, and again, we have been a global leader in the Caribbean in terms of getting rid of eliminating vaccine preventable diseases historically, and agility and resilience. The way in which the small island states of the Eastern Caribbean have needed to recover and reinvent from economic, environmental, and other shocks to their economies are a testament to our ability to be agile and resilient, and to really take a balanced look at where we are in terms of our environment and our health. So I'm going to leave it there, and I'm going to just ask if we can put the poll up. So I have a few questions for you that I thought would jog some conversation.
Great.
Are you able to click the polls part, Carlene? I just made you co-host.
Yes, I am.
Perfect. So it should just come up and you should just click launch.
Okay.
Yeah.
Okay, so you should be able to see a poll up on your, there's several questions, so you'll have to scroll. Don't just answer what you see in front of you. There's a little scrolling bar, so you can scroll to there are 4 questions. Just some random questions for you. All yes or no questions. So they shouldn't take too much time for you to answer. In the meantime, I'll take a look at the chat. Okay. Oh, there's a question in the chat that I can begin to answer right now. If you have a common currency, do the French departments that include Guadeloupe and Martinique that must use the euro therefore have 2 currencies? So in terms of the organization or the Eastern Caribbean Currency Union, not all of the member states are part of the currency union. So 8 of our member states are part of the currency union, and the 4 member states, the 3 member states are not a part of the current currency union, include the 2 French territories which use the euro. Okay, and I think the last poll says choice 1 and choice 2, but it's still yes and no. So just keep with the usual where yes should be and where no should be. So it's just really great. I've had, so I'm gonna just leave it up for I think a little while longer. I think we've had several persons give their answers.
Keep coming with your answers, but also with your questions in the chat. So there was a question from Carol Webley Brown that seems to have disappeared, but I'm sure it's there somewhere. And one from Steve, and now one from Michaela.
Yeah, I see the one from Steve, and I see the one from Michaela. I'm not sure. Oh, I'm seeing a question. Please mute yourself or stop the dog barking. That could have been my dog. My dogs are
I think we worked that out. We muted everybody else, Carlene, and we realized you were the guilty dog owner.
Yes, they're quite loud out there. Okay, let's see. It's Sarah, not Steve. You gotta change your name. It says Steve. What is it?
Sorry, I'm using my husband's account again.
Yes, I've been there. I've been there. You know,
I do have a deep voice though, so I can get away with it, Carlene.
I've been there for so many things in Zoom calls in this new era. So many stories that I'd rather not repeat. Are you seeing the average age of hypertension and diabetes getting it? So I'm going to go up and I'm going to start to answer some of the questions, but I'm going to end the poll, I think. And before I end the poll, I just wanted to reflect on, well, can you find St. Lucia on the map? That was just a fun question, just to challenge you a bit. You know, for most people, there's some parts of the world that it's not, can't necessarily find every country on the map. So just challenging here. Have you made any changes to your life because of the climate crisis? I love this poll response. Everybody said yes. So that is really encouraging for me, that there's a complete 100% yes to that question, and we can talk about it if you want to talk about it. But the last two questions, 3 and 4, have really struck me personally, because when now with COVID lockdowns and school from home, etc., I'm spending more time outside with my kids, and I'm realizing that they don't know a lot of things that I take for common knowledge about, what's growing, what that weed is, what that does, and I didn't realize how significant it was. And the things are outside, they're literally outside our door, but it means that there's been a shift in terms of what is common knowledge, in terms of what's in our environment. That's something that I've noticed, and I've now made a conscious effort to correct. But it's just something that I thought would be interesting. So I'm going to just end the poll. And I know that we're putting things in the chat, but I make note that we're all here and it's just a few of us. So I'm going to answer what's in the chat, but I would also encourage persons to, just open their mics and comment on the stuff that you've asked. So I've gone back to the top. Could we have the slides? Incredible information. I had no idea. Yes, I can share. Please mute yourself atop the dog. Yes, that was me. Okay, so is local produce expensive and unattainable to low-income families, or is it lifestyle choice brought up by desire to consume imported junk food? So there's a combination of the two. There's definitely a high, we import a lot of food, and those foods have become, the treats, the things that you can also get quickly or eat quickly in terms of things being prepared. Because if you're looking at local produce, you're looking at having time to prepare meals, and I can go on a whole different gender issue around what that means in terms of persons who may be economically disadvantaged. So unobtainable, I don't think local produce isn't expensive, but it isn't always available. Consistency is often an issue. And when the tourism industry is booming, farmers give first choice to the place where they're able to get that economic return. So you may be able to get the foods, but they may not always be available.
So they would sell the food on to the highest bidder, basically, rather than provide it to their local area.
Right. Yeah. I mean, and I'm not blaming anyone. It's a way of making money, right? You're growing food until we shift our policies to make it something different.
Yeah.
I wouldn't blame individuals because farming is also not a consistent source of income. So when you can get your sources, it's there. The question is tobacco consumption high in the Caribbean, and what support is available to help people stop using tobacco? And I think it's significantly decreased myself, but there are certain countries where it remains higher. So for example, if you go a little bit north, and I don't know if this is a UK influence, but certainly in the British overseas territories, it's higher. There's more smoking going on in the Virgin Islands and other spaces. And maybe if you go south, some of the things we're noticing, alcohol is a much bigger problem for us in the region than tobacco. It's a huge problem. And having said that, tobacco production does happen within the Caribbean, and so there can be some conflict between what we want to do with health and what persons want to do from an economic standpoint. And it's a packaging and redistribution of tobacco products.
Yeah, that's why I asked the question, actually, because I know it was produced there. And so I'm assuming it's so much cheaper and widely used. Yeah.
Yeah.
Thank you so much.
No worries, no worries. So I think we have now Michaela.
Mhm.
Yes, hi, Michaela.
Hi, thank you. So Michaela Nuttall and a nurse, and my thoughts first of all was like, oh my gosh, what a huge workload for people caring or trying to manage or prevent the long-term conditions, the diabetes, the high blood pressure. But then I started to think, are people getting younger and younger, given the rates of obesity? What is your average age? Where are you starting to see it? How is it evolving? So I had about 13 questions in one, but
No, these are great questions, and you're spot on. The obesity is going up, and now life expectancy of the next generation is actually expected to be less than the current. I mean, so right now, a statistic says 1 in 3 Caribbean children are overweight or obese. And it's higher in some places than others. And we are seeing the resultant younger age groups for diabetes and hypertension, and what we call type 2 diabetes more in younger persons than traditionally what we would have with type 1 diabetes in children. So we are seeing those numbers increase.
Wow. And I think we know that actually with children, well, young people that develop diabetes, high blood pressure and stuff, that inflammatory response on their bodies is probably going to cause a much more accelerated effect towards stroke and heart disease. So we're going to see that even younger in the future. So it's quite scary. But I saw something on here about how can we make things better, what initiatives are happening, because I'm sure there's lots of exciting things that are going on.
Well, there's a lot of things that are going on, I think, across the board, but a lot of things have been halted by COVID-19. Our health systems have been significantly stretched. Our communication systems, because there's a lot of communication around COVID-19, and our response systems. So there've actually been impact on persons with chronic disease in this COVID-19 period. Many of them have had disruptions in service, disruptions in supplies, some self-imposed, because some don't want to go out and put themselves at risk because there are a greater risk of complications related to COVID. And so there's a lot, I think there's a lot that has been going on that's been difficult to sustain while trying to sustain a COVID response. And so I think that the opportunities around COVID are more around the environmental response and the preventive response, but our health systems have just been significantly strained. So some of the exciting initiatives, for example, I mentioned before, backyard initiatives with diabetes families, that we've supported, for example, during the COVID-19 pandemic, and the ability to connect via telemedicine, which is happening across the globe, but it gives you access to a wider range of professionals from small islands, and things like that. Use of digital technology for keeping track of persons' chronic diseases. These are some of the things that are happening within the region, but I can't not speak about the impact really COVID is having on our health system.
Thank you.
Lilette has asked a question.
Yes, Lilette.
I don't know whether she wants to unmute.
Okay, yes, I see
Hi.
that. Yes.
Thank you for taking my question. I'm from Guyana, but I live in London, and I do work closely with Guyana. I'm palliative and life care facilitator. So
Yes.
I was in Guyana and I saw the way people were eating, and I just think about the awareness and the education that we need to educate these people on what to eat. Another thing I think about is that we have got the foods. We've got the pulses, which doesn't take very long. We've got all the beans and this sort of thing. And I'm just thinking that educating people around pre-diabetes and catching those people early could be a really good initiative. So because we know when somebody's a diabetic, they're about 5 years before that, they were pre-diabetic for 5 years, then they're diagnosed. So my thinking around that is, how do we raise awareness? How do we try and catch those people before they become full-blown diabetics? Thinking about the weight as well, because the weight has got a lot to do with it. That is a marker of people will go into diabetes. So we need to think about all those things. I know it's frustrating, and I love your talk. Thank you so much. I did enjoy that.
Thank you, Lilette. I mean, your question is spot on. You know the region. And, you know, I agree education is the answer. But this comes back to my thing about environment. Because we're educating, we need to we love to add things to the curriculum for the poor teachers. You know, add it to the curriculum. We're going to teach it through the curriculum. And it's not always an easy fix. I know teachers, they're frustrated with us keeping adding things. So it's the way we teach, our whole approach has to change. But it starts even with the teachers. Now, my 10-year-old comes home and tells me her favorite teacher sells Rice Krispies treats at the break. Now, I have to balance between, okay, this is a good teacher who's teaching information technology, a young person teaching information technology. But then what are the policies that we have? What is the environment that we have that will allow him to be selling Rice Krispies treats?
Yeah. And my thinking too is that they could have Rice Krispies, but it depends on what they eat before that. So it's a culture change, and it's a really way of life that people have to be thinking about. Very difficult, I know, to do, but my thought is, well, how do we raise awareness among these adults that they cook differently? And it's not about the amount, it's not about the amount on their plates.
Well, for some of us, it is about the amount on our plates. I just have to tell you that. I don't know if you know how we eat in this Caribbean region, but we still eat like if we're going to go work, you know, 10 hours on a field or something, and we're not most of the time. We really have, I don't know, we have like 3 different starches on the plate. You gotta have the ground provisions, which is great, but you have that, and then you have the macaroni pie, and then you have the rice, and then you have the, you understand, it's not a meal until there at least, then there's a potato salad. That's the salad.
We need some kind of education in some way, because it's frustrating. It is frustrating.
So the amount on the plate, I mean, literally heaping food on a plate is not unheard of. And, you know, again, it's about our environment and our society. I remember being concerned, and people love to see people eat. You know, so when they say, "Oh, it's great, you're eating more, you're looking well," you know, with a little bit of weight. This is some of our perception.
Thank you.
I was with a group of Caribbean nurses some months ago, and they talked about meetings where there were only biscuits were English meetings, and that if the Caribbean nurses were organising the meeting, there was real food. Alistair, I'm conscious that all the questioners so far have been from women, and Alistair's asked dozens, but in particular, he's raised the issue of junk food, sugar, salt. Alistair, do you want to add to that? I think you're
on mute. You're on mute.
I think I'm unmuted now. Huh?
Yes, you're on mute.
Yes,
we can hear you now.
One of them is about junk foods, and there are enormous advertising influences, not just throughout the world, on what children eat, and it all seems to go back to the fructose and so on that was introduced into American diets in about 1970, and that's just more or less gone right around the world now. And but it does mean that when you have very small populations, it's going to be very hard to be able to get rid of the influences of all the foreign influences. I mean, do you have what are the TV stations that you have in Dominica or in
Lucia?
Well, I know what's happened in Jamaica because I go there quite often. But
Yeah, Carlene's speaking from St. Lucia, Alistair.
I'm in St. Lucia.
oh, you're in St. Lucia, okay, but
Yeah.
that's even smaller. So I think there's only about 70,000 people there. Is that right?
That would be more like Dominica. So St. Lucia is about 170. Not that it makes much of a difference. But
okay, but it does mean that you don't get the economies of scale that you get
Exactly.
in very big countries. Countries with more than say 20 million people. And I dare say that apart from Cuba and
we're conscious of the time, Alistair.
yeah, okay, but there's only a couple of countries in the Caribbean that have very many people, like more than 3 million people, and in that case, how are you able to influence this thing through your governments?
Yeah, no, it's a very good question, and you speak to some of the real issues. I noticed, Christine, that Antonia had a question, so I'm just going to answer it, and I'm going to answer Alistair's. Antonia's question about physical activity rates, and yes, they are decreasing, and yes, they are generational and gender differences. So it's decreasing in the generations. I mean, you know, we used to go outside and play. I literally have to throw my children outside and lock them out or something. It's not because there's not space available, it's because their device is inside, you know. And then there are gender differences. So women are getting less and girls are getting less physical activity. But going back to Alistair, and I'm looking at the questions you had here with regards to few Jamaican men are obese, but women are, and it's true. Women across the Caribbean have higher rates of obesity than men do. And so is there a reason? I would say this is more of a behavioral reason. If you understand what it is to be a woman and a mother, you know what I eat, rather than watch food go to waste. You know, there are behaviors women do that we have to stop ourselves from doing, like eating our children's food, because you can't watch it go to waste. So that's, you know, there are things around the exposure of women. We are much more of a caretaking generation. Gender. We're much more likely to be in both professions and within the home, spending time in the home, you know, doing things, whereas men are spending more time outside, playing football or, you know, socializing or doing some other things like that. So I think it's much more of a relationship to what the gender differences and gender roles are. And in terms of introducing taxes, some of our countries, I think in Bermuda, they've introduced a tax on sugar-sweetened beverages for a few years now. And there's been talk about introduction of taxes across the region. It's not necessarily been well taken up. So there's a lot of advocacy work to still be done there around both taxes, even front of package labeling is something that we have large advocacy for in the region right now in terms of processed food and junk foods, and reducing salt intake is a big issue.
So I was a couple of years ago at a Commonwealth meeting when I think it was probably Jamaica, it was one of the larger islands, was discussing a sugar tax, and the president of Coca-Cola flew into the island to talk to the country prime minister. And what I hadn't thought through, I think, was that in a way it wasn't just about the local people, but tourism was so important. And if you introduce something that was unpopular with the tourists, that was more important than something that improves the health of the local people. That's my words, but so the impact of tourism on things like diet and access to unhealthy food, I think, is often underestimated by countries where tourism is important, but not so important as it is in the Caribbean. Yeah.
I think you make an excellent point. You know, recently in COP, there was a declaration or a treaty around tourism and climate. And, you know, for persons to sign on to really look at tourism with climate, but maybe we need to be looking at tourism and access to these poor foods. Because, you know, we can't underestimate the economic impact of tourism. Because I will tell you, the shutdown of our tourism industry has sent many more people over the line into poverty. Loads of people have become unemployed, and the social toll is real. So when prime ministers make these decisions around what's important for tourism and what's important for the health of the individual, I understand it's not as simple as it seems. And I'm seeing firsthand the impact right now when we don't have tourism, without a clear, you know, without another
sure
economic activity. So I understand that, and you're right, we must understand the full context, and, you know, maybe encourage health tourism, ecotourism. There's a younger generation that maybe will, of travelers who are maybe, you know, we can think differently and more creatively around tourism.
With your lovely climate and your gorgeous beaches, there must be great opportunities. Carlene,
now, is there time? I know we have 2 minutes, but I know we have a couple of other questions. Do you have a hard stop?
Yeah, go for it.
Okay, because the question is, are Caribbean islands all considering legalizing cannabis? And the answer is yes, they are. Again, because they're limited
to the tourism.
They're limited economic opportunity. So if you talk about the cannabis issue and its potential, I mean, already from a marketing point of view, the Caribbean has a maybe a leg up, and you think about it's being used so widely in North America, etc. So certainly it's something being considered. I don't think it's necessarily going to be done, but it's certainly something being considered in I think in a majority of states. Now, for me as a health professional, because I see the impacts of cannabis on our populations, it has me particularly worried. If you speak to other health professionals, they may have an opposing view. So it's an ongoing debate. And ultra-processed foods, yes, the public health response. So we have an ongoing campaign right now, the OECS in collaboration with PAHO, UNICEF, on ultra-processed foods and trying to educate the population. I don't know how effective it is. We're trying our best to sort of send that message in terms of, but as Alistair said, what are people looking at? They're not looking at local TV. They're looking at BBC and CNN, or if they're looking at news, and whatever television programs are coming. Most of the television programs come from the US market. So that's where their marketing is coming from. That's where, so that's an important influence on the way in which young people, what they want to buy when they get to the grocery store and what they want to eat. All this stuff, they saw it on the ad and it looked great and it was cool, and they pressure their parents when they get to the grocery store. So I think I've covered most of them. I like the big tax, the tax on big plates.
Yeah, I think that's a great one. I don't think I thought of that one. That's a great one. Thanks, Alistair. Carlene, thank you. A big thank you for bringing our 2021 International Seminar Series to such a joyous end. So despite all the problems facing many of our countries and certainly yours, a delightful, bouncy, optimistic, but serious recognition of the issues. And please stay in contact as a friend of C3. And for everybody who's here, thank you very much for joining us. The last of our 2021 seminars, but there'll be more come the new year, not in the bad months of January, February, but March, then about, we'll be off with some more seminars from other countries originally designed to inspire people who came to a working breakfast in London. That's long gone. Now, any time of the day, any meal, and people from everywhere coming together to really think through what can we all do to help prevent chronic disease. Carlene, thank you very much. A happy Christmas to you and your family, and a happy new year to everybody. Thanks very much indeed. Bye.
Thank you.
Look after the dog.